So hello, everybody. I have a very special guest speaker for us today, Dr. Tammy Jones. She is an I'm going to say it wrong. She's an optometric physician. She's been practicing medicine as an eye doctor for 34 years. And she's going to share with us a little bit today about the pure products that she uses in her practice and why she uses them. So Dr. Jones, Dr. Tammy Holzclaw Jones, thank you for being on with us today. Please share with us a little bit about your background, your experience, and then what products you're using with your patients and why.
Yes, ma'am. Thank you so much for having me today. So I graduated from optometry school in 1988, which was probably before a lot of y'all were born. And I've been practicing 34 years. My daughters, both are practicing with me now. It's like to be a member of my family, you have to be in the eye business. Okay. My husband was an optician and my daughter's husband, the oldest one, is an optician. So everybody in my family is eye doctors or associated with eyes. I love what I do. I've done it, like I said, for many years. And so when Pure came into my life, I found benefits in my office too with some of the products. If you have dry eyes, if you're suffering from dry eyes, we tend to use omega-3s for, the meibomian glands because of the oil secretion, I should say. So we suggest them using Mila. And that helps on the dryness, and we have great success. It also helps, other issues such as their health, which a lot of people that come in my office have health issues. A lot of them are being sent by their doctor, their medical doctor, because of diabetic retinopathy or hypertension. And, I think insurances, most of them require, if you have diabetes, to have a diabetic exam. So we go in and we check the diabetes, for retinopathy in the back of the eye. And if you put it on Mila, then they're going to have other health benefits other than just their eye. It does help on dryness. Absolutely. Because the meibomian glands that are around the eye, you have 20 to 40 on each lid, and they become clogged. And omega-3s help relieve this dryness. So the second thing we use is Pure Excel. That's one of my favorite things, Pure Excel. We did kind of like our own studies at first when Pure Excel came out, and we put some patients on that had like cystoid macular edema, things that were going on in their eye that, their vision had dropped, and we supplied them with the Pure Excel, tried them on it. And, when people are at their last hope, anything you can give them to help them is just, that all they want to do is see. And if you can give them that little bit of hope by anything you can do, and so we tried them on Pure Excel, and amazingly, we had a lot of, we also used other testing other than just, subjective. We use objective testing such as OCTs, visual fields, fundus photography, Optos. We use different testing so that it wasn't just our own, whatever we thought, it was right. It was objective testing that couldn't be altered. It was actually proof, and so we did that, and we had some tremendous results, and like cystoid macular edema, diabetic macular edema just decreasing. So we sell a lot of Pure Excel in our office, and I'm a big fan of it because I've seen what it's done. We can't make claims, but I've seen people's prescriptions changing. I can't say that I'm going to tell you that your eyesight's going to get better, but you have glutathione in your retina and your lens. And with that, and increasing the glutathione in your body, it's your master immune. And if you have a good immune system, then you're going to be healthy all over also. I will say this, and I've never even said this to I don't think anybody. So some patients that I've been seeing since they were young, 2 or 3 years old, got COVID. And, if you do research on COVID, people that have low glutathione levels, which makes sense because their immune system is lower, are the ones that tend to be affected worse. Mm-hmm. So these patients come in, and it wasn't like the first time I saw them. I've been following them for years. And when you have a 30-year-old that comes in with cataracts that has to be removed, that should tell you something. I mean, their body wasn't healthy. They had, like I said, they were affected by COVID, and then, and it could have been that high doses of steroids were given to them that also caused this. But I really, feel if we can keep our bodies healthy, we can keep our eye healthy too, by using things. If our bodies aren't getting what they used to. And everybody knows that, look at the diseases, by 2050, diabetes is going to be 1 out of every 3 people. 1 out of every 3 of those is going to have diabetic retinopathy. So, I mean, I remember back when I first started, you might have 1 diabetic patient a day, and now it's like 1 out of every 4 that comes in. So, I mean, we're doing something wrong, and we need to do something right. So, Pure Excel was one of my favorite, but I think I'm going to have a new favorite now that we've come out with Vision One. I'm so excited. When I first met you all and we went to, I think it was Destin. I talked to the VIP of sales and told him, I said, I really wish that y'all would come out with a pure form of something for vision, because I'm prescribing all day long these vision supplements, and I'm concerned that they're not the purest form. I'm not saying anything, but for instance, titanium dioxide. A lot of supplements have titanium dioxide. It's banned in Europe. It causes nose, throat, eyes, lungs, irritation, and in animals, it's shown to be carcinogenic. So, and we have it in our candies our kids are eating. I mean, it's in eye supplements. It keeps things whiter and fresher. And so it's in your coffee creamers. It's some toothpaste. So they're trying to get it out of the supplements, but a lot of supplements still have them. And so I prescribed or recommended for years, certain eye products that I'm going to be switching over because of that one reason. And the new Vision One is amazing. It has the same ingredients as the AREDS 2 study, which was, there's been AREDS 1, AREDS 2, and then they did a 10-year follow-up. The difference in AREDS 1 and AREDS 2 is they took out the beta carotene because it showed a 0.9% to a 2% increase in lung cancer. So that's why they removed the beta carotene and they moved it over to zeaxanthin and lutein. And there's no known instance of lung cancer. So if you are a smoker, or even some studies say former smokers, you should really definitely use the AREDS 2. You can still get the AREDS 1 products out there, but I would just stay safe and go with AREDS 2. I even saw one study that said if you were exposed to asbestos to use the AREDS 2. But anyway, it has zinc, copper, vitamin C, vitamin E, zeaxanthin, and lutein. And the Vision One even goes a step further and has astaxanthin, bilberry, and GOJI. So some information on that is of the top 7 brands, only supplement to contain astaxanthin and GOJI is Vision One. It has 40% bilberry than the 7 leading products. GOJI, natural source, lutein. GOJI is a natural source of lutein, zeaxanthin, and beta carotene. And there's 50% more lutein and 150% more zeaxanthin than the leading products on the market. So, and astaxanthin is amazing. I mean, I think that and glutathione is going to be my 2 favorite things, which glutathione is in Pure Excel.
Why? Let me ask you this, Tammy. Why are they your favorites? Like what can people expect? And so you don't know my history, but I'm negative 7.5 prescription in my eyes. Okay. I have not been able to literally see without contacts or glasses since I was a child.
That's what Randy was.
Why is this good for me? What benefits would because you're talking about the AREDS. I don't even know what any of that means. I just know I don't want to struggle with things that I see the elder members of my family struggle with. What can I expect to see? I know we can't make any claims, but why would I take it? What are the benefits potentially?
So these are they're antioxidants. Okay. Like astaxanthin is 6,000 times more potent in fighting free radicals than vitamin, 550 times more potent than vitamin E in fighting free radicals. So,
Okay, and that's in the Vision 1.
right, exactly. So
Okay.
you want to, your eye needs nutrition to stay healthy.
Mm-hmm.
And we're not getting the nutrition that we need. You need to eat. Okay. So you do not store, you do not manufacture zeaxanthin or lutein. Okay. So in
Or
order,
omega-3s.
right. And in your body, in order to, and this is from studies years ago before we knew how much our soil's depleted and our vegetables and fruits don't have what is supposed to be in them, or the nutrition value that we had before. You have to eat 3 cups of kale or 3 cups of uncooked and 1 cup of cooked kale per day in order to have the right amount of lutein and zeaxanthin in your diet. Now, this is before we even take into the factor that our vegetables and fruits don't have the nutritional value that they did before. So who does that? The average person gets 1 to 2 milligrams of lutein a day. And in the AREDS2 study, which showed, they did a study that showed how can we stop or slow one of the top causes of blindness in the adult age-related disease of macular degeneration. And it showed that the supplements that I just went over, the AREDS, which I was talking about, is what they could do. That's what they could take in order to take intermediate stages of macular degeneration to keep it or slow it down from going to the advanced stages. That's the only thing that we have. Now, there's 2 types of macular degeneration. One is wet and one is dry. Well, basically, wet is dry gone bad. Wet is when dry starts hemorrhaging and blood vessels growing in the macular area and starts leaking. Okay. So what they do, they go in and give you a VEGF injection all the way through your eye, or they do laser to stop the bleeding. And that puts you back to dry now. So there is the only thing that you can do right now is supplements to help stop or slow the progression of macular degeneration. Now, my thoughts on the AREDS2 study is they only studied people that had intermediate stages in the AREDS2 of macular degeneration or advanced. And they showed 25 to 30% decrease or slowing down of macular degeneration to the advanced stages with these supplements, and 19% improvement of central or save the central vision, 19% of stop of central vision loss. So I don't know what else to say.
So from your experience, I know that you've been sharing these products. The Vision 1 is new, but I know you've been sharing the Mila and the Pure XL in your office for how long now?
3 years, almost 3
3
years.
years. You've seen the results in your patients. You were saying you guys have done your own kind of internal studies. I know there's a pastor on my team, Danny Bagwell, who was getting, he has diabetes, type 1 juvenile, and he was saying he was getting shots in his eyes every 6 weeks he would go in. And this was before we had the Pure XL. This is before we had the Vision 1. The doctors were blown away, and he doesn't have to get shots in his eyes anymore. I don't know if you've seen that testimony before. Whatever it is, I can attach it to this video. But it's I know, like, who wants to get shots in their eyes? Not me. That sounds horrible.
Well, my sister did have to do that, and that's what. And you saw the inside of her eye in that. You know, there's a huge difference in normal and abnormal. And basically, diabetic retinopathy is leaky blood vessels, just like macular degeneration wet is. And they use injections for both of those, the VEGF to stop the leaking and the bleeding.
And I think most people probably don't think about their eyes until something happens. And then it's like, oh my gosh, this is terrifying.
Right. So one of the saddest things that I have experienced in my office is when somebody comes in and they've tried every doctor that they've known, and they come into us and they say, I just want to read my Bible. And you know how many people that, well, you know, I don't read my Bible like I should. And it makes me feel so guilty when they say that, because that's the reason they're there. I want to read my Bible. And I've had to leave the room, come back because I was crying, you know, because you go back and you tell them you can't do anything to help them. I mean, that is
Oh
the
my
saddest
gosh.
thing. It's, these people, I mean, 2,200 or worse, light perception, and you can't help them. And as an eye doctor, that's all I've done all my life. And when you can't do that, that rips your heart out.
And I know that's why you and your husband and your girls, we've, now traveled the world together because of the amount of people that you have shared Pure with. So tell me a little bit about how you found out about Pure and what the experience has been for you personally and your family that's caused you to decide you have to share this with others.
So I was introduced to Pure, and it was a really tough time in my life. I just lost my mother. And then a year later, I was told my dad had stage 4 colon cancer. So fortunately, my daughter was working with me so I could take off work, and I basically took care of him for 9 months. And I watched him go from 250 pounds down to 89 pounds. And we were real close to my family. I mean, my mom and dad lived beside me, and I talked to them and saw them every day. And so after I lost my dad, I went into like a depression. I mean, it was really tough. So I put on about 20 pounds, I guess, and depression. And then, so with that comes health issues. And you don't really realize those two things in combination, how much they affect your whole body. And so I started having interstitial cystitis, and I was going to the doctor and having bladder flushes every week to 2 weeks, where they would use lidocaine, heparin, buffer, and they inject that. Well, they drain your kidneys and then they inject that in your kidneys. So basically your kidneys are like little blisters inside, and it's almost like a baby having diaper rash, because it's like, how red and blistered their little bottoms get. And then when they pee, it sets them on fire. Well, this is internally. So the inner layer, what I was explaining was the inner layer kind of sloughs off, or you don't have that protection from the urine inside your bladder. So it's like a kidney stone and a UTI on steroids. Basically, it hurts so bad. You go to the bathroom, you would cry when you go to the bathroom. And I'm so my daughter ends up getting put to bed rest. She was pregnant. So I'm forced into going back to work, and I'm trying to work in these conditions. And I was eating Peridium like candy. I mean, it's just because that's the only way I could function. So
Peridium numbs the urethra for everybody who's listening. So you cannot feel the pain that's happening in the kidneys and the urethra. It's like a numbing agent.
And it makes your pee really bright red. If that probably will, some people will know what that means. So, like I said, I was going to the doctor, and then somebody told me about Pure. And I was basically like, the main reason I probably took it was to get them off my back, because I was like, you really need to try this, and then also I needed to lose some weight. I was like, I'm really getting fat. So, and that happens with age, and, and I just didn't care. And all I wanted to do was sit on the couch and cry. I mean, between the pain and the depression of losing my dad and my mom. So I started taking Pure in January of 2020. So it's almost been 3 years. And at that point, that was the last bladder flush that I had. I have not had one in all those years. So, and the thoughts of even going through that again, I could cry just talking about it, because it's horrible. It's horrible. You can get disability from interstitial cystitis. I mean, it is a painful.
I had regular UTIs my whole life from the time I was a child until Pure. It is, if you haven't had a UTI, you don't know how bad it is. But what you're talking about, like you said, that just takes it to the 10th degree. I can't even imagine. So life-changing. It was life-changing.
Exactly. And when I went to the doctor with these bladder flushes, he gives me a piece of paper and says, you need to change your diet. Here's what: no tomatoes, no spices, blah, 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 blah. I mean, I guess you would just eat a banana all day. I don't know what you would eat, because it was like nothing you could eat. And this was forever. This is how you controlled it. And I mean, so I started taking Pure. I did the detox, and I took all the products, and it went away, or went in remission, whatever you want to call it. I don't have it no more. I've not had it in 3 years. Now, I didn't tell anybody what was going on with this, because, I wanted to make sure, because
Yeah.
I see patients and I didn't want to do any false claims or anything like that.
Yeah.
I can tell people what happened with me and what's going on with me. And I wanted to make sure that this wasn't just a fluke, that it just went away for a month or two. So I give it a year. And then after a year, I got my kids. Well, my kids actually took it before a year, but my daughter has lupus and Casey has really bad knees. She trashed her knees playing basketball and had numerous surgeries, tore ACLs, MCLs, PCLs. I mean, she is a train wreck on her knees. And my son-in-law actually, her husband now lost like 60 pounds doing pure over a year. But so also another thing I was dealing with is I had acid reflux so bad that we ended up getting a Tempur-Pedic bed just so I could raise the head of my bed. I would wake up and I would literally be where I couldn't breathe, like aspirating in my lungs because I'd be, like gasping for air. And I couldn't even tell my husband, Randy, what was going on. He just knew I wasn't breathing and I couldn't talk. And he would be like running around. You did not want to be choking with Randy because he freaks out. That is his biggest fear. I've done the Heimlich probably on 5 or 6 people in my life at restaurants, and my husband, and I never see him, but he's like, Tammy, that lady over there's choking. So you want him around because he tells you that somebody's choking, but he's just not going to do anything about it. So, I've done all kinds of people Heimlich maneuvers, but anyway, so that's something else that went away. Totally. I don't have acid reflux. And if I ever, I don't ever wake up in the middle of the night with it, but if I ever feel like I'm starting to get it a little bit, all I do is hit my noni. Now that stuff doesn't taste the best in the world, but that's my favorite thing in the whole world as far as, the juices and stuff for me.
Yeah. Knowing it works. So acid reflux, interstitial cystitis. Wait, well, you lost weight.
Yes.
I mean, you looked amazing last weekend, so I know you've lost weight.
That's so sweet. So also there was something that I totally even forgot about to one of my staff. She's worked with me like 12, 13 years and she takes the products too. So always in the office when we wash our hands, we don't use hot water that much. It takes a long time for the water to get, warm. So I'd wash my hands and I had Raynaud's or Raynaud's, however you say that, Raynaud's.
Your fingers get all blue for those of you who don't know, and it hurts. Right?
Oh yeah, and it would turn white. It would turn totally white, especially my middle finger, and then a little bit of this one. It looked like you just painted it white. And she'd always, and patients would always say, "Look at your finger," And so it's just because the water was so cold. And whenever my hands got cold, even when I get in my car in the winter and put it on the steering wheel, it would do it. Well, I totally forgot about that. Do you know that that's not happened in almost 3 years? Awesome. She said the other day, she said, I just realized you're not having a situation with your finger. I mean, your fingers aren't turning white anymore. And I was like, you know what? I didn't even realize that until you just said that. It's just like I just forgot about it and just quit happening.
Pain's a funny thing. You forget it until somebody brings it up. Tell me briefly about Brooke's lupus. What's happened with her?
Well, so she started taking the products. She was on Plaquenil. She had a variation of lupus / scleroderma. And so she wanted to get off Plaquenil. She did not like taking it. We know what it can do to your eye. But, I mean, if you have to take it, you have to take it. But she was like, if there's another alternative, I want to find it. So she started taking Pure, and all her blood work, the last time she had blood work was perfect. I mean, her blood work was perfect. So she doesn't take Plaquenil anymore.
So you're talking about a lot of, like you've mentioned a few different things. What does Dr. Tammy Holzclaw Jones, what do you take on a daily basis from Pure?
Everything. I mean, I literally take everything.
So you take the Core Complete, right? Which is the whole Core plus the Super Fruits. You take the Pure XL.
Right.
You're taking 1 or 2 of the Pure XL a day.
I take 2, and I take Immune Plus and 6.
Immune Plus and 6 and the Vision 1.
Right. Vision 1. And then now I take the new Neuro Boost.
I'm taking that too. Neuro Boost. Yep. And I know your whole family does it too. And I know you've got little grandkids that take it as well, correct?
Yeah. Sometimes I give them to my kids, especially when they have stomach issues. I sneak it in their food. and they don't know it. Like if I'm
Right.
spaghetti sauce and stuff, you can't taste Mila. And I put it in everything. I mean, but and it's so funny about noni. Uh, I was so like, every time I turned around, I was like, I need my noni. I need, when I first, was getting rid of my acid reflux and stuff, that my kids made fun of me, and my name is Noni. That's what they call me. My grandkids, it's Judy and Noni. That's who we are.
Instead of grandma, they call you Noni.
Noni.
I love it.
So also, right after my sister passed away, my dog was diagnosed with 99.9% of cancerous tumor in his nasal sinus passage. And they said he'd eventually go blind and of course die. And the tumor would push through his eyes and throat. And so he was suffering. He couldn't, she couldn't breathe. She was like, I mean, that's the way she walked around. So we took her to a oncologist. Believe it, they have oncologists for dogs. And they diagnosed her and they said, we probably need to do a trach and radiation. Well, the dog is 12 years old. I just watched my sister go through a trach and they couldn't keep it on her. It would come unhooked and it was horrible. And there was no way that I was going to put a dog through that. Right. So I said, okay, so if all this stuff is helping me, I have nowhere to go but up with this. Let's try Pure on the dogs. So my two dogs get Mila with a mixture of greens and sulfur in it. And then they get a shot of, and I researched this. I research all the time. I'm all the time reading stuff. They get GOJI and mangosteen and noni. And that's what I put. I put about a half a shot of each one of those. Actually, now I put it in a bottle and mix them all together. So I just give them a shot of that and they lick it up. Now, at first they was like, I don't know. And then, but they lick the bowl. I mean, they love this combination. And I just put it in with their food. I try to give them more vegetables with their food. I saw something, one time on TV about a dog that was really sick and they changed their diet to like vegetables and stuff. And because of the dog food, what it has in it, and some of them, if you see, it would gross you out. I mean, like roadkill and all this other stuff. So, yeah. So my dog, I mean, she's in here right now and you don't hear her breathe. I mean, she's, of course she's 13 years old, but she is not even the same dog. I mean, her breathing is normal. She's laying over there on the couch right now. And
that's awesome. Wow. Well, Tammy, I so appreciate you jumping on today to share your story, to share your experience. I know a lot of people are going to be sharing this with their eye physicians as well. And I know it's just been a light of hope for so many people. So thank you for taking the time out today to share with others.
God bless y'all. Thank you so much.